malignancies. Yeah, they're going to be called malignancies. Cystadenoma carcinoma. Yeah, so it's going to be just, all you're doing is just adding carcinoma. Serous cystadenoma carcinoma and mucinous cystadenoma carcinoma. So those, we're going to be studying those cystadenomas again, but the malignant form. Okay? Endometrial cancer. It's the most common cancer in the United States. Someone from my church just lost her, I think she was 29 when she died of endometrial cancer. So it can happen at any age. Risk factors are going to be obesity, nulliparity. What is that? No pregnancy. She's never been pregnant. Late menopause. Someone that did not start menopause until, say, my age. Okay? Because usually a woman will go with her menopause. Sometimes you can have early menopause, and early menopause can hit in the 30s or the 40s, and you usually always go through menopause by your 50s. Okay? Polyps. Polyps inside the endometrium. Polyps inside the cervix. Polyps, they take them out because they can turn malignant. Okay? Family history. If I have family history of endometrial cancer, then I have a chance of passing it down to my children even. Okay? And unopposed estrogen. That means your estrogen is haywire. Okay? Predisposing factors are going to be their hereditary. Breast cancer. Breast cancer, they give you tamoxifen. And tamoxifen is an estrogen drug, and it causes endometrial cancer because estrogen is what helps our endometrium grow. Okay? And of course, other risks are birth control pills and smoking. It's amazing, isn't it? That smoking can even affect your endometrium. Okay, this is a endometrium that is complex. Do you think I am transvag or transvaginal? I mean, transabdominal or transvaginal? Transvaginal. Are these sagittal or transverse? Yeah, I thought this looks like it's sagittal, but that's why I read down here, it's a transverse image of the endometrium. I thought it was sagittal on what kind of uterus? Because this looks like the lower uterine segment to me. So this would be a retrouterus, okay? But then when I got up there and read it, they're all transverse endometriums.
No, A say sagittal.
A?
Yeah, it say this sagittal endovaginal image.
Oh, it is sagittal.
Yeah.
So this is a retrouterus. Okay, thank you, Dewey. Because I looked at it and I was going, that looks like that sagittal, but these look like they're transverse.
Yeah.
Okay, so if this is sagittal, this would be the lower uterine segment, so this would be a retrouterus. Because your cervix is on this side if it's a retrouterus. We can suspect endometrial cancer, but they can't diagnose it until they send that tissue to the lab. That's what it means by histology. They send it to the lab and they are able to make the diagnosis down there, okay? You've got two types, type 1 and type 2. You've got one where you have long-term estrogen therapy. I had a hysterectomy in my 20s. I'm on hormone replacement therapy. We call that HRT, I turned 60 and I've got endometrial cancer. Okay? Well, I had breast cancer because I wouldn't, if I had a hysterectomy, I wouldn't have an endometrium. Okay? Type 2 is atrophic. What does atrophic mean? Atrophic. It's not growing the way that it should. A means without. Okay? And if I've had ovarian cancer. If I've had ovarian cancer, my chances of having endometrial cancer would be greater. Yes?
She had a uterus. She was bleeding. And we did see something wrong, but Miss Jessie couldn't say what it was.
Mm-hmm.
Would you have an idea what it would be if there's no uterus in there?
There's no uterus?
She had her uterus.
She had her uterus removed, but there was something round.
But she had bleeding. There was bleeding going on.
Where's the bleeding come from? Because there's no outlet.
Right. I don't know.
Because if they take the uterus, they take the cervix.
Right.
It's just a cut.
Right. Yes.
That doesn't make any sense.
Even Miss Jessie did not explain it, but she could see that there was something anechoic there.
Yeah. Now, you can develop cancers of the cuff. Like say they didn't remove all of those cells.
And you know,
Those cells
she
can
did
grow.
have both. What's it called when you get both removed breast cancer? She's a breast cancer survivor.
Uh-huh.
Now she's freaking out because
Now she has bleeding. Yeah. Mm.
And she's a lesbian, so she had never had anything penetrated there.
Yeah.
50-something.
Yeah. Mm. Get her medical record number and we'll follow up on it.
Yeah.
If you have it on your numbers,
Yes, I
keep
do.
it, start it, and then we'll look at it next week when those reports go back.
Right, because
We
even
can
Miss
follow up on it.
Even Miss Jessie,
Mhm.
because I was like, so what is it?
Yeah,
Nothing
unless
else.
it's something with the cuff. Who knows? I don't know. Okay, so those are just the classifications, y'all can look at that. Endometrial cancer usually happens to someone in their 60s or their 70s. You have bleeding, pain, and uterine distension. What is uterine distension?
Too much.
It's growing, it's too big, it's distended. Like if I eat too many jalapenos, it's gonna distend my belly, okay? So that's what that means, is the uterine distension. And why is it distended? Because the endometrium has endometrial hyperplasia. Overgrowth. So they can do a total hysterectomy. This would just be called a TAH. This and this and this would be called a TAHBSO. Total abdominal hysterectomy. I've had my uterus removed. TAHBSO. I've had my uterus and my ovaries. TAHLSO. I've had my uterus and my left ovary and tube removed. TAHRSO is I've had my uterus, my right ovary, and tube removed. Okay.
B is for bilateral.
Bilateral. Bilateral, left side, right side. Okay, so when we do that first film, we put the G, right? How many times they were pregnant, how many times they gave birth, how many abortions they've had. Okay, we put that on there. If they've had a hysterectomy, this is how we document it. not just TAH, but we also have to tell them if they have ovaries or not. Okay? You will be surprised at the number of patients that have no idea what kind of surgery they've had. Okay? So you'll put TAHBSO and you get in there and they have beautiful ovaries. Because they, no, everything's gone. Okay? The way to get around that, so you don't make a mistake, is did they put you on hormones after your surgery? Because a lot of times they'll put women on hormone replacement therapy, and that is called HRT. HRT. Hormone replacement therapy. Okay, if they take my stuff out down here, okay, they're also going to remove lymph nodes. Okay, now my lymph nodes run in a chain. They run this way and they run this way. Okay, the closer that they're malignant here will depend how much they're going to have to remove of my breast. However, further they get down closer to the pubic area, then I'm going to have problems with lymphadenopathy, meaning my legs are going to swell. Okay, it's usually whatever side they do the lymph surgery on will be the side that swells. And it's because the lymph chain has been broken. Okay, so that lymph from my leg can't escape. The lymph from my arm can't escape. You know those big, heavy, elastic things that women wear? They also have them for the legs. You just don't see them. And it kind of keeps them compressed, so it keeps the lymph out. Or I can have radiation and chemotherapy. So when we look at the endometrium, we're looking to see how thick it is and what is the echogenicity. It should be homogeneous, okay? It should never be heterogeneous, okay? It should never be heterogeneous. Here is an endometrium that is very thick. Look at that. I only see a little bit of myometrium around it. It's lost its shape and it's very, very big. It's very heterogeneous. Something is seriously wrong. Okay? Look at this endometrium. So here is the myometrium. Myometrium. What are these little things right here? Arcuate arteries. Arcuate arteries, because they're around the periphery. Arcuate arteries. And here it looks like I have a solid hemorrhagic-like growth inside my uterus. Okay? I know it's not hemorrhagic because look at these different areas in there. So I have how would we describe that as sonographers? We're not going to say the diagnosis. Large heterogeneous mass intrauterine. Okay? Or you can say heterogeneous endometrium. Okay? Here is a transvag on a uterus that is opposite, because here's my cervix over here, so it is either a retro or a retroflexed or retroverted. Which one is this one? Verted, okay, because there's not a bend at the cervix. so it's verted. If there was a bend at my cervix, it would be flexed. Okay? So I have an endometrium that is too thick with anechoic structures in there. So I would just say a heterogeneous endometrium.